are zooming in on one topic in particular, talking about some of the myths your clients may believe to be true about Medicare. Fun fact, when I sat down to make this list, I had a few ideas in mind. After doing some research, the list ballooned to include over 40 misconceptions. Some of these were surprising to me, and I think it's because I've been in this industry for almost 10 years now. We always say you don't know what you don't know, but I think this research was a good reminder that even when we do know, we can forget that others don't know because we are too close to the subject matter. I think it's important to keep these in mind as we're talking with everyone, not just those turning 65 for the first time, but leads and clients of all ages. We're surrounded by this information all day, every day. For our clients, they talk about it with us. Then they go and talk about it with their family and friends, and we all know how the game of telephone goes. Misconceptions can happen quickly and easily, so not only is it important to know where confusion may happen, it's a good idea to know how to combat that confusion. So let's kick it off with myth number 5. If your spouse has Medicare, you're automatically enrolled. We know that Medicare is individual health insurance coverage, but this can be an area of confusion for those when one spouse has already retired and the other is just starting their planning. I think this myth stems from the ability to add your spouse and dependents to employer health insurance policies. Probably the first thing we learn about when we cover the basics of Medicare is how different it is from the health insurance we carry when we're under the age of 65. But our clients don't know that, so it's important to dispel this myth just in case. This can be as simple as bringing it up with your clients during their appointments. And if you're working with someone whose spouse is still working, give them some basic Medicare educational information with your card stapled to it. Suggest they give you a call when it's time for their spouse to start planning so that you can all sit down together if you aren't already meeting with both of them. Myth number 4. Medicare Advantage plans and Medicare Supplement plans are the same. MA and MedSup plans are usually compared to each other. So at face value, it does make sense that people could think that these two types of coverage are the same. The detail that's likely overlooked is the fact that this is an either-or situation. You can either have Medicare Advantage or Medicare Supplement, but not both. The way that I think of the difference between these two is to think of Medicare Advantage as Medicare Part C, its official government name. It's made up of Medicare Parts A and B, is offered by private insurance companies, and was designed as an original Medicare replacement. The Advantage part comes in with the potential addition of Part D in MAPD plans, and then other benefits depending on the carrier, plan, and the market. Medicare Supplement, on the other hand, was designed to supplement coverage of original Medicare, also known as Medigap. It was designed to fill in some of the coverage gaps of original Medicare. Still doesn't cover everything, but gives your client coverage to help with deductibles, copays, and coinsurance. Medicare Advantage replaces original Medicare, while Medicare Supplement fills in gaps, supplementing original Medicare. Coming back to the concept of you don't know what you don't know, I think we sometimes forget how differently Medicare is structured compared to employer health coverage prior to retirement. Having some type of resource that explains the basics of Medicare, the breakdown of the parts, is a huge help in explaining how Medicare works. We've mentioned Ritter's content library before here on the podcast. It is a great place to find ready-made educational content for your clients, including information like the basics of Medicare insurance. These resources are formatted in different ways, so after you've determined your use case, you can download what you need. We format resources as an article, digital content for an email or newsletter, an infographic, social media post, and more. My recommendation? When you set up a Turning 65 appointment, send the Basics of Medicare Insurance article over with their appointment confirmation. That way, they can read it ahead of time. When it's time for the appointment, print out the handout version to give to your client along with other educational materials. As you're talking through the different types during the appointment, point them out on the handout and make sure that when it's time to leave, that handout is included in the packet of information your client takes with them. Next up, myth number 3. You can't make changes to your Medicare plan. I honestly don't know if I was surprised by this when I first started out in the industry. I guess I'm surprised by it now, knowing what I've known to be true about how plan rates can change just at an employer level. So it sort of made sense that it would be true for Medicare as well. This is another thing that is really important to go over with clients. Medicare plans can be changed, but there are specific times and circumstances around when that can happen. And there are other considerations to keep in mind. Changes can be made during the annual enrollment period from October 15th through December 7th. Your clients can change from Medicare Advantage back to Original Medicare, go from Original Medicare into a Medicare Advantage plan, or switch like plans from Medicare Advantage to Medicare Advantage, MedSup to MedSup, Part D to Part D. There's also the Medicare Advantage open enrollment period from January 1st through March 31st. This gives beneficiaries enrolled in Medicare Advantage plans the ability to change their coverage if they're unsatisfied with their Advantage plan. They can select a different Medicare Advantage plan or return to Original Medicare during this time frame. It's important to remember that the Medicare Advantage open enrollment period is for Medicare Advantage beneficiaries only. Those enrolled in Original Medicare cannot use it to pick up an MA plan. Beneficiaries either swap one MA plan for another MA plan or return to Original Medicare, and then they can pick up a MedSup and Part D plan if needed. Other than that, special enrollment periods exist that are designed to cover big life changes that don't have a specific time frame, like moving or the loss of other coverage. Couple more special considerations to keep in mind. Medicare supplements are guaranteed issue during the initial coverage election period. After that, most MedSup plans will require underwriting for enrollment, as well as a qualifying circumstance to make a change during an SEP. On the Medicare Advantage side, enrollment changes are similarly bound. They can happen with qualifying circumstances during a special enrollment period, but are mainly relegated to the annual enrollment and the MA open enrollment periods. There is something called the Medicare Advantage trial right and the Medicare Supplement free look period, but those have very specific qualifying circumstances that can vary from state to state. We will have more info on those in the episode notes. To dispel this myth, you can cover information like this and use the content library resource we have around enrollment. I would also bring it up more than once during the conversation. You can talk about making changes to enrollments during these enrollment periods as you're explaining them. Let your clients know that these are the time frames that changes are able to be made. Once they've made a decision on the plan type, Medicare Advantage or Original Medicare with a Medicare supplement, go back and explain how changing the plan works within the framework of their choice. That way, you're able to explain to them that if they choose a Medicare Advantage plan, they'll have to go through underwriting in order to be able to go back to Original Medicare and pick up a MedSup at a later date. For some, getting into a MedSup guaranteed issue the first time around is going to be the only way they can afford a MedSup. For others, higher cost or going through underwriting won't be prohibitive, but it's very important to make sure your clients understand this before enrolling for the first time so they don't end up with buyer's remorse. Myth number 2, Medicare will cover all medical expenses. So this is a wonderful idea, but definitely a myth. Medicare coverage is made up of a lot of different parts. Each part covers a different type of medical expense. Part A of Medicare is hospital insurance. It is what it sounds like, care that happens in a hospital setting, so inpatient stays, skilled nursing facilities, and hospital care. Part B is the medical insurance. This is coverage for visits to the doctor, ambulance rides, lab tests, and medical equipment. Part D is prescription drug coverage. Plans create formularies, a list of drugs they cover, as well as the pharmacies where beneficiaries can get them. Original Medicare combines Parts A and B. Medicare Advantage combines Parts A and B to replace Original Medicare and sometimes throws in Part D coverage and other additional benefits. There are a couple things here that I did not mention, like dental, vision, or hearing coverage. Those are sometimes offered in limited form in Medicare Advantage plans, but not always. For truly comprehensive coverage in those categories, like what we're used to prior to retirement and Medicare coverage, most people will need to purchase an additional insurance policy that specifically covers those items. Also not mentioned, long-term care services like a prolonged stay in a nursing home or lengthy home health care. Medicare offers some coverage for short-term care in specific facilities under specific conditions. Those facilities are not nursing homes for a lengthy amount of time. A lot of people assume that it is included in Medicare, but no part of Medicare covers long-term care. LTC coverage can be purchased as an additional insurance policy. This is another area of confusion that can be cleared up with some simple Medicare basics information. And that brings us to our number 1 myth, the one that seems to persist, that Medicare is free. Medicare is not free. For this myth, I always think of that old euphemism that nothing in life is free, and it is certainly true when it comes to Medicare. But there are reasons people might think this is true. For one, in Australia, Medicare is free to the people that live there. However, their Medicare is not our Medicare. And here in the US, Medicare is not free. There's also the fact that most people pay Medicare taxes during their working days. From there, it's possible that they're taking the benefit portion of Social Security and ascribing the same sentiment to Medicare because both are government programs. But there's a difference. One is a benefit. That's Social Security. The other is a federal program providing health insurance for people aged 65 and older, as well as those with certain disabilities. That is Medicare. And going into more detail on cost, each part of Medicare has different determinations for how much a person pays. Whether that's the work requirements for Part A, the IRMA for high-earning Part B beneficiaries, or the myriad ways Part D plans differ from one another because of how their formularies and prescription tiers are structured. Despite Medicare's differing structure from the health insurance coverage we hold prior to retiring, cost structure is still similar. The different parts of Medicare have premiums, deductibles, copays, coinsurance, and other out-of-pocket costs. Coverage is parsed out to the different parts of Medicare, and the costs differ in amounts depending on service, plan type, carrier, market, and other factors. Again, Medicare, not free. This is another misconception that can be cleared up with educational resources and conversations with our clients. I think it's important to remember what we said at the top of the episode. We don't know what we don't know, and really remember that when it comes to the people we're serving. Have a conversation with them. Ask questions. Find out what it is they need. And let's be honest, we know that they came to us to talk about health coverage. But don't forget about the education piece of the equation. If you can help them feel confident that they understand the purchase they're about to make, that's going to go so much further than just the transactional process of buying an insurance policy. We mentioned some specific resources from the content library during this episode, and we'll be linking to those in the episode notes. Just a quick reminder, in order to view those documents and download them, you'll need to register with our site, ritterim.com. We will have the registration link in our episode notes. That way, you can get signed up, logged in, and gain access to those resources. Now, another thing I mentioned earlier, there are a lot of myths around Medicare. So our list today could possibly end up being just the first of more episodes covering this topic. If that's something you'd like to hear, let us know. Our contact info can also be found in the episode notes, as well as the ability to follow along with our show. And we hope you'll do that to take advantage of the content we have to offer. But for now, I hope you have a great weekend. Stay healthy and stay safe out there. And we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.